Hello and welcome to this channel. In this video, we will learn about Brugada syndrome. Let's begin. Brugada syndrome is cardiac sodium channelopathy, that is, there is a fault in cardiac sodium channels. This condition can lead to fatal arrhythmias such as ventricular fibrillation and sudden death, typically in young males. Pathology. Brugada syndrome is due to a mutation in the cardiac sodium channel gene. Over 60 different mutations have been described so far. At least 50% are spontaneous mutations, but familial clustering and autosomal dominant inheritance have been demonstrated. Mutations in the SCN5A gene that encodes the cardiac voltage-gated sodium channel are found in 15 to 20% of cases. ECG patterns in Brugada syndrome. There are three types of ECG patterns in Brugada syndrome. In type 1, there is coved ST segment elevation greater than 2 mm, in more than one of leads V1 to V3. ST elevation is followed by a negative T wave. This is the only ECG abnormality that is potentially diagnostic, and it is often referred to as the Brugada sign. The other two types of Brugada ECGs are non-diagnostic, but if found, possibly warrant further investigation. In Brugada type 2, there is greater than 2 mm of saddleback-shaped ST elevation, instead of typical coved ST elevation. In Brugada type 3, ST morphology can be of either type 1 or type 2, but with less than 2 mm of ST segment elevation. These ECG changes can be transient, and can also be unmasked or augmented by multiple factors, such as fever, ischemia, multiple drugs including sodium channel blockers like flecainide and propafenone, calcium channel blockers, alpha agonists, beta blockers, and nitrates. Cholinergic stimulation, cocaine, alcohol, hypokalemia, hypothermia, and post-DC cardioversion are other factors that can unmask or augment ECG changes in Brugada. Diagnosis. Brugada syndrome can be diagnosed by coved ST elevation in V1 to V3, associated with one of the clinical criteria. Clinical criteria include documented ventricular fibrillation or polymorphic ventricular tachycardia, family history of sudden cardiac death at less than 45 years age, coved-type ECGs in family members, inducibility of VT with programmed electrical stimulation, syncope, or nocturnal agonal respiration. Management. The only proven therapy for Brugada syndrome is an implantable cardioverter defibrillator or ICD. Quinidine has been proposed as an alternative in settings where ICDs are unavailable, or where they would be inappropriate, for example in neonates. Screening family members is important for picking up undiagnosed cases.